Male fertility is an underappreciated and yet very common piece of the conception puzzle for many couples. Let's take a little closer look in more detail at different aspects of male fertility and how we take care of our male patients. Male factor infertility is much more common than we would popularly think it would be. It affects up to 40% of couples trying to conceive, oftentimes as either a single male factor or in combination with a different female factor. So the causes of male fertility can run an entire spectrum of things related, starting with congenital things that people are born with or chromosomal conditions, extending into different lifestyle-related conditions and also other medical conditions that are very often correctable. The conventional wisdom is that fertility testing should be initiated for couples at either 6 or 12 months of unprotected intercourse. There are some exceptions to that. If it would alleviate a little bit of anxiety, it's a reasonable time to test. If you have a pre-existing medical condition that you think might impact your fertility, it's better to test earlier rather than later. A semen analysis is a very simple, straightforward test to do. It gives us very good metrics. We measure things like ejaculated semen volume, sperm count and motility, and the shape of the sperm, all of which can impact your natural ability to get pregnant. I think the simplest approach to this is to simply do the things that you know are good for you. Eat a reasonable and healthy diet. There's nothing that you need to either go overboard on or avoid altogether. Limit your consumption of alcohol. Don't smoke. You can take a multivitamin that might help as well with an antioxidant component. Maintain a healthy weight and get some exercise. So it's really very basic fundamentals of healthy living that are going to dovetail very nicely with good fertility practices. The process by which men make sperm, and an important consideration for us, is the management of time relative to improvements in sperm count. So what I mean is that when sperm are created and sperm are generated on a constant basis, it takes approximately 2.5 to 3 months for sperm that are generated on one day to then mature and then appear in the ejaculate. So this becomes really important because when we're juggling whether or not to prioritize the treatment of the male or the female partner, there's always a time management piece. Whether it is a hormonal optimization or a surgical intervention to try to improve sperm counts, it can take 3 to 6 months for those improvements to set into place to then continue the process of trying to get pregnant naturally. So this becomes really important in the time management of a couple, particularly in patients where the female partner may be over the age of 35. Men's ability to make sperm really doesn't slow down as rapidly as, say, egg production does for women. Men will generally make sperm throughout their entire adult life. That sperm will go through its life cycle. If it's never used, it's disposed of, broken down, reabsorbed, and new sperm takes the place. So the treatment options can run from non-invasive and medical, so hormonal optimization, looking at testosterone levels, maximizing the production of a hormone called FSH, which is responsible for sperm production. There are also surgical interventions. Sometimes men are born with blockages, or perhaps they've had a vasectomy in the course of their life. These things can be reversed or rerouted. And then ultimately, we can do sperm retrieval procedures for men who don't ejaculate sperm. We also do, very commonly, varicose vein corrections for men who are looking to try to improve their sperm counts and motility. Your fertility journey is deeply personal to all of us. Whether you're at the early stage and the outset of your journey, or whether you've had fertility treatments and evaluation elsewhere, our experts are happy to help walk you through this journey hand in hand. Please feel free to reach out to any of our partner practices or our website directly for an easy way into meeting one of our experts.